Okay, everybody, let's do chapter 22, Assessing Health Status. We are going to discuss the types of assessment used in various situations, demonstrate the techniques used during a physical examination. The clinical practice, we're going to highlight assessing the patient's psychosocial and physical functioning by gathering information in an organized way, perform a basic physical examination on a patient, perform a visual acuity test on a patient, carry out focused physical assessments of the cardiovascular, respiratory, gastrointestinal, and neurologic systems. We'll start with data collection and assessment. So when we are collecting data, it is a continual process. Our initial detailed assessment is on admission, and it's going to include a physical exam, history and demographic data, information that is pertinent to daily care and current health problems. We do an assessment on every shift. When a patient is admitted into the hospital, a long-term care facility, another agency, we always do an initial assessment. Nurses must be aware of how an illness is affecting a person's life, not only physically or health-wise, but in all other areas. So a cultural assessment is mainly a matter of asking the patient and family about preferences for food, bathing, and personal care, what they think about their illness and treatment, and who should be consulted about decisions. Do not assume that just because a person is a member of a certain ethnic group, he or she has beliefs and practices common to that group. The initial or admission assessment should include an interview to determine social data, marital status, occupation, visual or hearing deficits. We need to determine if the person has any, do they wear dentures? Do they have any prosthesis? Another thing is to pay attention to if they are wearing glasses or hearing aids. Do they have any allergies, food, drug, or other? Medications that are being taken. So we'll do a complete medication reconciliation, meaning we go over all their medications, all their home meds, and we need to include over-the-counter medications as well as herbal supplements in addition to their prescription medications. We have to note a patient's level of physical fitness and independence. We want to ask them questions about their diet. Do they have any limitations or special foods? Do they smoke? Do they use alcohol? What are their activities of daily living like? Do they struggle with any of those? If they've had any previous surgeries, what their health problems are currently and past, and why are they there? So the reason for admission. What questions do we need to ask about their physical health? So we're going to collect information about their the physical data is going to include their head and their neck, their chest, their heart, their lungs, their abdomen, their GI system, and extremities, musculoskeletal system, and their endocrine system. We'll get into that in more detail. The information gathered from the physical assessment can be used for a variety of purposes, including determining the patient's level of health and physiologic functioning, arriving at a preliminary nursing diagnosis of a health problem, confirming a diagnosis of a dysfunction, disease, or inability to carry out activities of daily living. Activities of daily living are often referred to as ADLs. We also want to assess specific body areas or systems for additional testing or examination. We want to evaluate the effectiveness of prescribed treatment and therapy and observe for any adverse side effects. We want to monitor for changes in body function, determine whether there are any signs of abuse. Physical examination techniques. So inspection and observation. So this is when we are looking at our patient. Inspection and observation. So we're going to inspect visually the various parts of the body and behavioral responses of patients. So I'm going to tell you right now, your assessment starts the minute you walk into the room. You are observing your patients. You're picking up on their nonverbals. We're going to look at their general appearance, contours of the body, the skin tone and color, rashes, scars, lesions. We're constantly assessing skin. No matter what you're doing, you're constantly assessing the skin. We're also going to be looking for any deformities or extremity weakness. Palpation. So palpation is when we are actually touching the body, okay? It's performed by using the hands and the fingertips to touch and feel various parts of the bodies. We use it specifically to determine size and shape and position of body parts, texture, temperature, and moisture, presence of muscle spasms or rigidity, pain, tenderness, or swelling, any presence of growth anywhere on the body, restriction of body parts or movement of body parts, skin temperature and turgor, and presence of edema. Percussion is used primarily over the chest and abdomen to determine the size, location, and density of organs that lie within. The most common type of percussion is when it consists of striking the middle finger of one hand with the middle or index finger of the other hand. Auscultation is when we are using our stethoscope. So we're listening with our stethoscope. Particularly, we use this for lung sounds. We're going to use the diaphragm for all lobes. For heart sounds, we're going to use the diaphragm for normal S1 and S2. And to count the heart rate, then you flip your stethoscope around and use the bell of your stethoscope for some abnormal heart sounds. And then we use the stethoscope to auscultate the abdomen. And we're going to be listening in all four quadrants for the bowel sounds to ensure that they are active in all four quadrants. So here's a nice figure of how you auscultate the heart in each area. So you're always going to start with the aortic landmark, then move to the pulmonic, then the tricuspid, then the mitral. We are also going to use olfaction, which is our smelling, okay, during assessment. And what are we smelling for? We're smelling for different odors that are associated with different problems. So we're smelling for, do we smell any sweetness or acetone or alcohol smells? When we're assessing a wound, we're going to assess the smell of the wound. Odors from discharges such as vaginal infections. I know this doesn't sound like a bed of roses right now, but this is something that we do as nurses. So, and just to speak a little bit more about this, a fruity odor to breath can indicate diabetic acidosis. Alcohol on the breath can provide a clue that the patient's lethargy or irrationality. Foul mouth odor may indicate periodontal disease or poor hygiene. A foul or sweet odor coming from under a cast or a wound indicates infection. A foul odor in a female's genital area may indicate a vaginal infection. We want to identify standards that are used to compare measured heights and weights. Discuss the basic rules to follow when measuring vital signs. We're going to do that in lab more specifically, and you guys know to look at your skills book for that. And we've talked about vital signs. When we are reviewing the body or the body systems, we're going to cover the head and the neck, chest, heart, lungs, skin and extremities, abdomen, genitalia, anus, and rectum. So we'll talk about that more. Head and neck, we're going to look at the general appearance. We're going to look at the appearance of the eyes, the condition of the hair. Is it thin? Is it thick? Difficulty in hearing or seeing. Once again, you're going to pay attention if they have hearing aids or if they're wearing glasses, or you can ask them, do they wear contacts? We want to look at the pupils. We want to make sure that they're equal in size. We want to make sure that they accommodate to light. And the corneas, are they clear? Or is there opacity? And opacity is one of those medical terms. Go ahead and look it up if you don't know what it means, and make a flashcard. All right, for the chest, heart, and lungs, first thing that we're going to do is ask ourselves, is the chest symmetric? So you're first just going to inspect the chest, and the chest is expected to be symmetrical. Are the shoulders at equal height? Is there one shoulder up, one shoulder down? You know, we have to take a look at that. Is there any lordosis, kyphosis, or scoliosis? Any signs of dyspnea? Is there any noticeable point of maximal impulse or PMI? I'll talk more about that when we're in lab 2. Are the heart sounds normal, S1 and S2? Is the apical pulse rate normal? And apical, we're going to listen to apical for 1 full minute. When we are assessing lung sounds, we're going to use the diaphragm of the stethoscope and listen over the trachea, over the upper area of the chest, over the central chest, and back. Then we're going to decide what are those sounds? What do they sound like? And I want you guys to use your books and look up the words for the different sounds: vesicular, bronchovesicular, and adventitious. We'll talk about those in lab when we're doing our assessments too. But look these words up, find out what the definitions are, and also take a few minutes and go to YouTube and look up lung sounds and listen to them. So when we are auscultating the lungs, we're going to start right where it says 1, and we're going to start at one of the ones and then move over to the second one. Then you'll go to 2, and then to the other 2, and then to 3, and then the other 3, and then to 4, and then the other 4. And then we go to 5 over there on the side, and then we go to 5 on the other side. And I will demonstrate this in lab for you guys. Then on the person's back, this is posterior, okay? You're going to start again at the 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. You see, you go all the way down to 7. You're going to listen a lot to the back because we can hear the lungs better in the back. We'll move to 7, and then you see we go to 8, and then we go all the way over to the other 8, and then we go to the 9, and then we swing around and we listen to the last landmark of number 9. Again, I'll show you that in lab. Breakdown of the skin is a common problem. Skin sensation and sensory function tend to diminish with aging. So we want to make sure that we are inspecting the skin constantly. Like I said, we have skin from the head to the toe. So all throughout your assessment, you are going to be assessing skin. You're going to be looking for rashes and lesions, flakiness, dryness, signs of dehydration or edema. We also want to check their skin turgor, cap refill, and assess their peripheral pulses. When we move to the abdomen, we want to assess all 4 quadrants. Normal is 5 to 30 sounds per minute. If it's less than that, then they would be hypoactive. If it's more than that, they would be hyperactive. And if you don't hear anything, then that's absent bowel sounds or silent bowel sounds. And hypoactive and absent, there's a big difference, okay? You cannot chart that you have found absent bowel sounds until you have listened to the quads, all 4 quads, for 5 minutes. And that's a long time. You guys know how long it takes to listen to the heart for just 1 minute, let alone 5 minutes. So that's a long time. But trust me, you do not want to chart absent bowel sounds if there really are some bowel sounds. So listening that long is necessary. You also, when you're assessing the abdomen, you want to look for distension. So distension is like bloating and or tenderness. Okay, those are very important findings. Abnormal findings. Distension is abnormal. Tenderness is abnormal. All right, now, if you can take a look at this figure and just put this X, imagine putting the X on a person, and that's how the bowel sounds are separated. So when you listen to bowel sounds, you're going to always start in the right lower quadrant. Then you're going to move to the right upper. Then you're going to go to the left upper. Then you're going to move to the left lower. So that's how you listen to bowel sounds. You will auscultate in this position, and you also palpate in that same order. Always right lower, right upper, left lower. All right, unless the patient has a specific complaint in these areas, the genitalia areas, the nurse does not visually assess them. They may be assessed, however, when bathing a patient, performing perineal care, or assisting with toileting. That is a good time. And I will tell you, a lot of STNAs are tasked these jobs, and as the nurse, I would always ask my STNAs to tell me when they were getting ready to shower the patient or do some perineal care or something like that, because I wanted to come in to help, number one, and secondly, I wanted to be able to assess my patient's bottom. The bottom is probably the most common place for bed sores to occur. So you really want to have your eyes on your patients completely. You want to have that opportunity during your shift, because if you don't look at the patient and all of a sudden some other nurse down the line finds that the person has a bed sore, you could, take the heat for that. Ask the patient specifically if they're having any problems with any of those areas. There is a systematic way of performing an assessment. We want to make sure that we are interviewing and gathering a history, performing our physical examination, or assisting the health care provider while they are performing the physical examination. In many instances, a nursing assessment of the areas of basic need is more appropriate than a total physical assessment by the nurse. So that's another thing. If the doctor was going to go in and he was going to do his assessment, that's another thing. I would kind of like always tag along. Number one, because if they just do a quick one, you can see what they do. And, if they're looking at the patient's back or bottom or whatever, looking at the wound because they're a post-op patient, then part of your assessment can be completed at that time with the doctor there. The other thing is always go into the room with the doctor because they might start talking to the patient and they might start talking about new orders they're going to be putting in. So that's another reason why always going in when the doctor's there is a good idea. What are focused assessments? Focused assessments are going to be brief examinations when you don't have to do a complete head to toe, maybe something's going on. So most of the time they are like your cardiovascular, respiratory, or your gastro. And we usually do them when they come out of surgery a lot of times, or when we are suspecting a problem of some sort. Maggie's patient has been receiving dialysis for several months. She has a dialysis shunt in her left arm. When taking vital signs on her patient, it is important to remember, number one, blood pressure should be measured on both arms after a patient has been resting for 5 minutes. Number two, blood pressure should be obtained in the left arm only. Number three, blood pressure should be obtained in the right arm only. Or number four, if blood pressure is elevated, it should be taken in the other arm. So hopefully you guys know, and if you don't, well, this is a learning opportunity. Never take a blood pressure on an arm with a dialysis shunt. So the correct answer is number 3. If a patient has an elevated blood pressure, you should not take it on the same side as the shunt. You may repeat it on the same side in a few minutes, the same side you just took it in. So repeat it on the right. If it's still high, you're going to notify the healthcare provider. Okay, question 2. On auscultation, Maggie notices her patient has rhonchi in her lungs bilaterally. Rhonchi can be best described as, number 1, whistling musical high-pitched sounds produced by air being forced through a narrow airway. Number 2, coarse, low-pitched, rattling sounds caused by secretions in the larger air passages. 3, it should be cracking sounds, not croaking. Well, maybe it means croaking. Croaking sounds heard when there is partial obstruction, or fine or coarse sounds that are high-pitched. Okay. The answer is number 2. Rhonchi are described as coarse, low-pitched rattling sounds caused by secretions in the larger air passages. A wheeze is a whistling, musical, high-pitched sound produced by air being forced through a narrow airway. Stridor is a croaking sound heard when there is a partial obstruction. Crackles are fine, coarse sounds that are high-pitched. Question number 3. During the physical examination of your patient, he states, I have a ringing in my ears. This is known as number 1, vertigo. Number 2, tetanus. Number 3, not tetanus. Number 2 is tinnitus. Excuse me, guys. Number 3, cerumen. Number 4, petechiae. So the answer is number 2. Tinnitus is a ringing in the ears. Vertigo is a sensation of rotation or whirling movement or dizziness. Cerumen is earwax, and petechiae are pinpoint round purplish red spots. These are medical terms. Make some cards with those, please. All right, the second section of chapter 22, health status data collection and examinations. So in this section, we're going to go over and describe how to gather information for a comprehensive database, teach patients the assessment techniques for early detection of cancer, educate patients about recommendations for periodic diagnostic testing, and assist with medical examination by positioning and draping the patient and organizing equipment. So we are going to start off with assessment of areas of basic needs. So this is an acronym, RN's HOPE, which include rest and activity, nutrition, fluids and electrolytes. S is for safety and security, and our HOPE is hygiene, oxygenation, psychosocial and learning, and elimination. Patient education, so topics can include the following: the need for regular physical examinations, recommended periodic diagnostic tests, the need for immunizations, the necessity of regular dental examinations, and the warning signs of cancer, and when to notify their doctor. Positioning and draping. Most examinations begin with the patient seated on the end of an examination table with a drape over the lap and legs. Patients assume the supine position and a drape is pulled up over the upper body so the chest and the abdomen can be exposed. We use different positions, the lithotomy position, knee to chest position, lateral or Sims position, and prone position. And I will go over the positionings. We will go over that in another lab. A female nurse must be present in the room at any time a male nurse or a male health care provider performs a pelvic or breast examination of a patient. It could be another male nurse or a doctor. It doesn't matter, but we always have to go in the room with them. Common procedures that a nurse may be asked to perform are a urine dip or a urinalysis, a hemoglobin measurement, a random blood sugar measurement, an electrocardiogram, and possibly a spirometry reading. Does anybody know what PERLA stands for? It's P-E-R-R-L-A. P-E-R-R-L-A. You need to know what PERLA means. It's another acronym, and it means that the pupils, for P, pupils, the E is equal, the R, the first R is round, second R is reactive, L is light, and A is accommodation. Again, PERLA, P-E-R-R-L-A. Pupils equal, round, reactive, too light, and accommodation. We do perform neurochecks at regular intervals on patients who have had a head injury or brain surgery. We do need to measure pupil size when we're doing a neurocheck. Patient is asked to track the nurse's finger or an object as it is moved into 6 different positions. I'll show you guys the neurocheck that we'll do when we come in to do our assessment next week. The Glasgow Coma Scale is used in most hospitals to score a neurologic exam. Evaluating the techniques of physical assessment and thoroughness of data collection is an individual responsibility. Questions to ask are: were all areas assessed adequately? Were all pieces of data missing? Were there any pieces of data missing from the assessment? Was the patient comfortable during the assessment? That's very important, you guys. Did the interaction remain focused on the assessment? Was all equipment available for the examination? Was the patient positioned and draped appropriately? And were procedures and their purpose explained to the patient? Question number 4. A systematic way to perform an assessment is to use the acronym RN's HOPE. Which letter is correctly defined? Number 1, H for health. Number 2, O for oxygenation. Number 3, P for physical. Or number 4, E for evaluation. The correct answer is number 2, oxygenation. RN's HOPE stands for rest and activity for R. N is nutrition. S is safety and security. H is hygiene and grooming. O is oxygenation and circulation needs. And finally, E is, oh, excuse me, I skipped P. P is for psychosocial and learning, and E is for elimination.